Every June 8th, the world unites to confront a silent but formidable adversary: brain tumors. World Brain Tumour Day is more than a date. It's a global movement to raise awareness and support for those affected. The aim is clear: shine a light on the challenges patients and families face, and empower people with knowledge. This day connects us in a shared mission, reminding us that no one faces this battle alone. It's a platform for education, a catalyst for research, and a source of hope. Each year, thousands receive a diagnosis that changes their lives overnight. World Brain Tumour Day cuts through confusion, offering clear information about symptoms and the importance of early detection. By spreading awareness, we help people take control of their health. The day also highlights the urgent need for more research and funding. Treating brain tumors is uniquely challenging, demanding innovation and dedication from the medical community. On June 8th, we honor the researchers, doctors, and nurses who push the boundaries of medicine. This day fuels the search for better treatments and ultimately a cure. At its core, World Brain Tumour Day is about people, their courage, resilience, and the support they give and receive. It's a day to honor those we've lost and stand with those still fighting. By coming together, we build a strong, united community. We send a clear message: no one should face a brain tumor diagnosis alone. This is our promise. World Brain Tumour Day began in Germany, sparked by the compassion of the German Brain Tumor Association. In 2000, they saw patients and families struggling in isolation, with little public understanding. They established June 8th as a day to unite people worldwide in a common cause. The founders, patients, families, and healthcare professionals knew that awareness was the first step toward change. Their goal: bring brain tumors out of the shadows and start a global conversation. This grassroots movement gave the day its authentic voice. June 8th became a symbol, a fixed point for reflection, action, and hope. The idea quickly spread, embraced by advocacy groups and healthcare organizations around the world. The message was universal. Brain tumors are a global challenge needing a global response. Today, World Brain Tumour Day is observed in over 100 countries. It's grown from a small initiative into a major international event. The legacy of the Deutsche Hirntumorhilfe proves that determined people can change the world. Their vision created a lasting platform for progress and hope. Millions now have a voice, and life-saving research is being funded. Every movement starts with a single courageous step. World Brain Tumour Day stands on 4 pillars: awareness, education, support, and research. Awareness is crucial. Brain tumors are often invisible until symptoms become severe. This day spotlights the disease, helping people recognize early warning signs like persistent headaches or seizures. Early diagnosis can save lives. Education is the next pillar, dispelling fear and misinformation with reliable, accessible information. The day demystifies brain tumors, explains treatment options, and shares the latest research. Education also reaches healthcare professionals, ensuring better support for patients. Support is essential. A diagnosis can be isolating, but this day connects patients and families to a compassionate community. It highlights support groups and advocacy organizations that provide vital resources. No one should feel alone in this fight. The final pillar is research and global solidarity. Progress depends on innovation and collaboration. World Brain Tumour Day advocates for more research funding and international cooperation. Brain tumors are a global problem. Solutions must be global too. By uniting efforts, we accelerate discovery and move closer to a cure. This solidarity is the foundation of hope. Together, we can change the future for everyone affected. That's why this day matters worldwide. Awareness is the foundation of progress. Without it, myths and misconceptions thrive. World Brain Tumour Day breaks the silence, sharing real stories and humanizing the disease. Personal accounts motivate action, turning empathy into advocacy. Education partners with awareness, providing clear, accurate information. With over 120 types of brain tumors, the complexity can be overwhelming. This day simplifies information through resources like fact sheets and webinars. Empowered patients can make informed decisions and partner in their care. Education also targets policymakers, employers, and community leaders. They need to understand the impact and support survivors returning to work or school. Public education campaigns teach people to recognize persistent, unusual symptoms. Early detection opens more treatment options and improves outcomes. The message is simple: listen to your body, know the signs, and seek help early. Time is critical in oncology. Awareness can save lives. By educating everyone, we build a more compassionate, inclusive world. World Brain Tumour Day is a call to learn, share, and act. Knowledge is power. and it's the first step to change. Let's use it to save lives. At the heart of this fight are people, patients and families facing a life-altering diagnosis. Medical treatment is vital, but so is emotional and practical support. Support groups offer safe spaces to share experiences and find understanding. World Brain Tumour Day highlights these resources, encouraging people to connect. Knowing you're not alone brings strength and hope. Families often face financial strain and complex healthcare systems. Advocacy organizations guide them through insurance, financial aid, and care options. This support relieves stress, letting families focus on what matters most. Caregivers, spouses, parents, friends, are unsung heroes, providing round-the-clock care. Their role is demanding and often overlooked. This day honors caregivers and raises awareness about their needs. Supporting caregivers strengthens the entire support system. Together, we care for the whole person, not just the disease. Despite progress, brain tumor patients face steep challenges. Lack of public knowledge leads to delayed diagnoses. Symptoms are often subtle or mistaken for other issues. Early detection is critical, but many don't get it in time. Access to specialized care is limited, especially in rural or developing areas. Advanced treatment requires expert teams and technology, often unavailable outside major cities. Financial burdens are immense. Treatment costs can devastate families. Some forgo care due to expense, a reality we must change. The brain's complexity adds scientific hurdles. The blood-brain barrier blocks many drugs, and tumors are highly diverse. One-size-fits-all treatments rarely work. We need sustained investment in research. Innovative therapies like immunotherapy and personalized medicine offer hope. Overcoming these giants requires global effort and commitment. The fight is long, but every step forward matters. We must not give up. The future of brain tumor treatment is filled with hope and innovation. Personalized medicine is transforming care. Treatments are tailored to each tumor's unique genetic makeup. This approach promises better results and fewer side effects. Technology is revolutionizing diagnosis, and surgery, advanced imaging, and minimally invasive techniques improve outcomes. New methods like focused ultrasound may help drugs reach tumors more effectively. Immunotherapy is emerging, training the immune system to fight cancer. Early results are promising, but more research is needed. Global collaboration is essential. No single country can solve these challenges alone. Sharing data and expertise accelerates progress. World Brain Tumour Day brings the global community together for this purpose. By working as one, we move closer to a cure. The future is bright if we continue to invest, innovate, and unite. Together, we can turn hope into reality. In developing nations like Pakistan, the fight against brain tumors is even harder. Lack of awareness means many never hear of brain tumors until it's too late. Symptoms are often misunderstood, leading to late diagnoses and poor outcomes. Specialized care is scarce. Most centers are in big cities, out of reach for many. There's a shortage of trained professionals and advanced technology. The cost of care is overwhelming, forcing families into impossible choices. World Brain Tumour Day is a lifeline, bringing attention to these urgent issues. It's a chance to push for government action and international support. Investment in healthcare infrastructure and training is critical. Local education campaigns must dispel myths and empower communities. International partnerships can help build sustainable systems. The fight in developing nations is a fight for basic human rights, health, hope, and life. We must not leave anyone behind. World Brain Tumour Day is a call to action for us all. It's a reminder that unity and compassion can drive real change. We stand with patients, families, and the medical community in this fight. This day symbolizes hope and the power of working together. Let's honor survivors, remember those we've lost, and channel our energy into progress. Hope is active. It fuels research, supports patients, and inspires advocacy. Let's demand better access to care and more funding for research. Raise awareness in your community. Every action counts. Support organizations making a difference on the ground. The fight is a marathon, but together, we are unstoppable. On this day, let's unite as a global family. Let's light up the world with hope, unity, and determination. Together, we can create a future where no one fears a brain tumor diagnosis.